Welcome back, 7:45. It can happen to any of us, even if you're diligent with washing your hands, immune boosting, and avoiding people. It's still possible to get slugged with the flu, and you can catch it more than one time in a year. Dr. Ken Redcross, board-certified internal medicine physician and author, joins us this morning. Good to have you back. How are you?
Thank you. It is wonderful to be here. It's cold, so this is the perfect time to talk about this, right?
And there's a lot of things going around. I know my kids have already been sick a couple of times. Not the flu, I think. I never know how to tell if it's the flu or something else.
Well, that's a good question. Remember that the flu comes on abruptly. You tend to have a high fever, and the other thing is you get those body aches. Colds don't typically have those body aches.
Let's talk about things we can do, first of all, to not get it. Is there anything we can do?
You know, one of the bigger things, and it can be a little controversial, is the flu vaccine. We know that last year we unfortunately lost over 180 children, and 80% of them were not vaccinated.
Right. CDC really recommends it.
They really do. And this year it looks like we may have actually pegged it. So this may be a good vaccine as we see the studies coming out.
Okay, if you get it, is there any way to make it better?
There is. There are a few that I'll share this morning. So the most important thing is to remember the first 48 hours are the most important should you come down with the symptoms: fevers, chills, body aches. What I want to make sure is some of the don'ts is that I don't want you to go to work should you feel like you're coming down with these symptoms. It's incredibly important.
And
it's
your
hard.
coworkers don't want you to go to work.
And neither does your boss. So that's the other important thing. But what do I want you to do? I want you to make sure you consider a homeopathic remedy called Oscillococcinum.
What's that?
Now, Oscillococcinum is important because it's been shown to decrease the severity and the duration of flu-like symptoms when taken within the first 48 hours. Safe for kids 2 years of age and older as well. So very important. Now, what else can we do? So that's the beginning. But what about the middle when you're not feeling so great? What I do want you to do is I want you to go into the doctor because I want to make sure that we check and see if you do have the flu or not. Very important. But I also want you to stay closer to the earth with some of the things that can make a difference, such as elderberry. Now, elderberry's been shown to actually have some activity against the flu strain.
And that's, it comes in a liquid?
It comes in a liquid. I like it. You can put it in a tea. You can also put it under your tongue as well. And once again, it's a natural way. You also have Butterbur. Butterbur is unique. I'm bringing all these
It sounds like it's from Harry Potter, but that's butterbeer.
Oh my gosh, everybody asks me that. Well, I'll tell you, Butterbur is important for inflammation. It may have some activity to help for a headache, which also can come along with the flu as well.
Right.
The other thing you'll see here is holy basil. So anything that has holy in it, you better listen. And it's the same thing here. It's holy basil. It's very important. It helps you as far as expectorating, getting those secretions thinner. So very important. Last but not least, we're at the tail end of this thing.
Right.
So it's important that we make sure that we are staying hydrated.
Sure.
So I wanted to make sure I included some of that.
Does it matter what? Like, should I have water or should I have something else?
Water is great. I have a lot of patients say, Doc, I need something else. I'm not great with water. So that's why I have coconut water, which is great, naturally sweet on its own. And then I also have some electrolyte beverages that don't have some of that high fructose corn syrup in there as well.
But get those electrolytes and things you need.
Absolutely.
I know you've got a new book out called Bond, where you talked about the importance of the patient-doctor bond. How does that play in? Because I imagine you want a doctor who you feel you're connected with so you can talk to him if you get sick.
Yeah, you want to be able to have a doctor that feels like a member of your family. And you want to be able to pick up that phone and say, Doc, do I have a cold or do I have a flu? Can I get in to see you? And so it's so important that you have the trust, respect, empathy, and communication.
And not be afraid to call.
Exactly. And that's a big thing. You'd be surprised, but very important.
Okay, I got to go get that flu shot still, and hopefully we'll still stay healthy. There you see where you can get more information, drredcross.com. Thanks for being here, Dr. Ken Redcross.
Thank you for having me. Thank you.
Hopefully we'll stay healthy. Coming up, we still don't know what to get your kids for